Do you all have folders? Chris, if you give the folders, and I need water. The temporal lobe and the right hemisphere of it is facial recognition, music, social cues, object recognition, balance, temperament. When we do a QEEG, we can actually check the temporal lobe to make sure that person is not at risk of any traumatic brain injury or is losing the memory. So anyone with memory issues should be tested to prevent them from getting Alzheimer or being on the family of dementia. Thank you. Next one, Roxy. So the back of the head and the cells, they all come to the back of the head when we're born, and gradually by age 7, they complete having all the cells in the brain, and then they start prune and mature based on our hopefully good life, a very kind mother, and a lot of good environment, education, sport, music, and hobbies. The only way brain moves from the back of the head, which is emotion and memory, and doesn't stay in trauma or old memory or feeling sad or depressed, is when the brain is busy maturing and pruning to the front of the brain. Occipital is where we keep the trauma, and we all have been traumatized. Visual field, processing on all the visual information, reading, writing, spelling, memory, and all our traumatic memories stay here. So when we remember what happened and where we were on 9/11, is because anything that it's more traumatic or emotional stays in the brain longer. So that makes the reptile brain the fight-flight brain, and that is the first brain that we all have. If I'm parking and someone tries to park in my space, I'm gonna go to my reptile brain. We all have it. And then we have the second brain, which is the emotion brain, like mammals, dogs, cats, cows, horses, they all have that mammal brain, the emotion brain. The amazing thing about us is that we have the intellect brain, the adult brain in the front, and none of the other species have this third brain. Now it's up to us, as the baby is born, with kind mom, correct parenting, and doing a ton of things for the brain, and taking care of our diet and way of life, to give this brain an opportunity to not stay in reptile fight-flight mode, which is always full of fear, and get to the intellect. There is a brain doctor. He says that if we look at the world with our emotion, it's very tragic. And if we look at the world with our intellect, it's a comedy. And I think we should all go to the comedy page of it. The sensory motor cortex, the C area, deals with all our controlling our muscle movements, any body movement, identifying the sensation, spatial discrimination. If I can walk, talk, move, shake your hand, anything that we do, any decisions we make is because of this C area. In my practice, when we do the brain map and we look into the C area, people with epilepsy, tics, all kind of tics, people that have Parkinson and they have tremor in their hands, CP, cerebral palsy people, that they can't move very well. Any kind of movement, when we do the map and we give the treatment, they get better, and most of the time they don't shake if their hands or body parts shake. We have two hemispheres in the brain, really important to connect them well, and in my practice, we do that. The left side of the brain is the logic side, and the right side is the emotion side. The left and the right need to be in harmony, so we would be a normal person. So abnormality starts when there is a fight in our brain between our brain hemispheres. Emotion says something, and logic says something. So the right hemisphere deals with all our emotional, artistic, understanding a joke, having empathy, being a romance, laughing, and having all this sense of direction, nonverbal expressions. And then the left, the right side, when it's imbalance, it's all about depression. It causes depression. And then the left hemisphere, if it's not balanced, it deals with anxiety, creates anxiety. Sorry, the left one is depression. The right one, did I say it reverse? The right side deals with anxiety. The left hemisphere is our intellect, understanding, learning, rote memory, IQ, has no sense of humor. So when you see people that they are not very good with jokes and having a sense of humor, we call them nerds. They have more of the left brain. And then when you see people that are too emotional and they cry easily and they're sensitive, they're too much on the right side. Next. So let's see why we don't have a highly functional brain. We all talked about stress today, and stress is part of life. And if we don't control stress, it's going to cause a chaos in the brain, and it affects every cell in the brain. It's stress and the brain and the cortisol release of it that starts all our dysfunctions in our body too. I made a list of stress and the brain, basically I want you to know that if the brain releases too much cortisol, then it's going to give information to amygdala, the emotion center, that don't feel good, and then it releases the hormones that are really bad in hippocampus, which they all deal with sleep, memory, and recalling information and learning. So we're as good as our brain. 5 senses bring the information in, and it's up to us to be able to balance and control our stress. Otherwise, the brain ages rapidly. And at the Mind Therapy Center, we do actually have a lot of ways that we deal with stress, which I'm going to tell you. So common stresses are so many. You know it all, from the way we eat, from grief, from sexual trauma, from stimulants, exercise, lack of exercise. So they all are a factor. And for you to be able to meditate, to have mindfulness practice, and to allow me to do a brain map and give our treatments, the neurointegration treatment, we have been extremely successful in eliminating, or I shouldn't say eliminating, but being able to help patients to balance their stress hormones. We are as good as what we eat, and brain definitely needs fuel. If you don't eat, the brain will take all the fuel from your muscles in the brain, and it doesn't care whether you are eating or not eating. So we have to basically have good fuel, and the 360 transformation diet is actually what we use in our practice to teach people how to eat. Especially, I'm really worried about our teenagers, because with the social media pressure, they're not eating, and this is going to affect the brain, and it's going to interrupt the connection of the brain cells and neurons to the front of the brain. And if we don't have a front of a brain activity, we're in trouble. I gave some example of poor nutrition. Everyone mentioned about the refined sugar. Sugar makes you stupid and dumb. And that is actually a recent article by one of our brain doctors. Sodas are horrible, starches, exercise, the too much carb is not good for us. Hydrogenated oil, extra virgin olive oil is really recommended. And then you have to make sure that the food coloring, additives, and also the processed foods are not good for your brain. Caffeine,